Today we're going to talk about the proper way to assess a trauma patient. The goal of the trauma assessment is meant to be a quick evaluation so you can intervene and provide quick, life-saving treatment. As with all things medical, we are to remember our universal precautions and to always wear the proper PPE. The trauma assessment is broken up into 6 sections. Section 1 is a scene size up. This is where our corpsmen should be asking themselves a few important questions such as, am I wearing the proper PPE? This is important because trauma scenes are loaded with body fluids, sharp objects, blood, teeth, and when you mix in adrenaline, well, sometimes things just happen. Is the scene safe? Are there energized electrical wires? Am I at risk for being hit by a car or a bullet? You won't do your patient any good if you become a casualty, so utilize your situational awareness and stay safe. How is my patient injured and what type of injuries can I expect to see and treat? Always think about cervical, spinal precautions in trauma patients. You might also want to think about how many patients are there in the scene and will I need any additional help. Section 2 is a primary survey. The first thing you will do is determine how seriously injured your patient really is. This is the time to trust your instinct, so go with your gut on this. The next thing to do is determine if the patient is responsive and determine their level of consciousness. With this information, you will determine the chief complaint or the most serious injuries. Now, you check your ABCs. We start with the airway. Establish an airway if needed and determine if adjuncts are required to maintain that airway. Assess the patient's ability to breathe. Are they ventilating adequately? If needed, apply oxygen and attend to injuries that might create airway problems down the road. C is for circulation. Check a pulse at this time. While you're doing that, observe the patient, focusing on what their skin color looks like. Is it pale or cyanotic? Is their skin warm or cool to the touch? Now is the time to do a quick head-to-toe sweep of the body to check for major bleeding, and if bleeding is located, take the time to treat. Initiate shock management by placing patient supine and conserve body heat. The brain uses 20% of the blood pumped with each heartbeat. If our trauma patient is in shock, they will likely have a change in their level of consciousness. The tool we use to evaluate for changes to their level of consciousness is the Glasgow Coma Scale. This scale centers on the 3 parameters. The first is eye opening, the second is verbal response, and the last is motor response. Because it is impossible to remember the point values for each category when you're working a trauma code, the Glasgow Coma Scale is posted in numerous locations and should be laminated and kept with our corpsmen when working in a field environment. We will use this tool to make treatment and transport decisions depending on the score or how their score is trending. Section 3 is history taking. We will use a sample history in our practical, so why don't we just start going over that now. S stands for signs and symptoms. A stands for allergies. M stands for medications. P stands for pertinent medical history. L stands for last ins and outs, and that's going to be important, especially if the patient's heading to surgery. E stands for events. Basically, what were the events that led up to the trauma? Section 4 is a secondary exam. It is best if you perform this exam in a systematic manner every time you evaluate a patient. You do this so you don't miss something that could hurt the patient down the road. I always go head to toe, and that's the way you're going to be evaluated on your practical exam, so why don't we learn it that way? For the head, you inspect the head to include the eyes, nose, ears, and mouth. You can palpate the head and feel for bumps or some kind of deformity, also looking for blood loss. For the neck, check the location of the trachea, checking for midline positioning, look at the jugular veins and look for distension, palpate the cervical spine, feeling for deformity and also checking for pain. Moving down to the chest, look for deformities, feel for deformities, and listen with the stethoscope. You'll also sometimes hear abnormalities such as absent lung sounds, subcutaneous emphysema, or wheezing. Now you move down to the abdomen and look for discoloration and deformity. Then palpate the area, checking for pain or anything that feels out of place. Check the stability of the pelvis. And for testing purposes, this is what you'll do in the practical exam. Just verbalize that you have assessed the genitalia and the perineum region. Now we move to the lower extremities. Again, look for deformity. Feel for abnormal findings such as warmth, coolness, or deformities. Remember to check CMSTP. color, motor, sensory, temperature, and pulse for each extremity. Now go to the upper extremities. Look and feel for abnormalities, and remember that CMSTP mnemonic: color, motor, sensory, temperature, and pulse for each extremity. Now to the one area that is frequently missed, and that's the back. Just as with the front of the body, we will visually inspect the back and buttocks for abnormalities. Section 5 is obtaining the patient's vital signs. For us, our vital signs are going to include the blood pressure, pulse, and respirations. The first set of vitals will give you a baseline, and then any future vital signs that you get will be compared to that initial set to identify trends with the patient. This section is also where you manage the minor wounds or injuries that were not life-threatening but worthy of treatment down the road. Well, at this point, we're down the road, so let's tend to those wounds now. The last section is reassessment. Just because you check your patient's airway once doesn't mean it will remain patent throughout the remainder of your time with this patient. When you get your set of vitals, go back to the primary survey and start assessing your patient all over again. You'll be surprised how much more you notice the second time around when you actually do this in real life. So good job staying awake. Now let's go out and smash that practical.